Did you know that a pill you take for your heart health could secretly be harming your sexual health? As a board-certified urologist with years of experience helping men improve their sexual function, I've seen this scenario more times than I can count. Many men come to my clinic feeling frustrated about weak erections, only to discover that their blood pressure medication may be the culprit. Erectile dysfunction is a sensitive issue, and too often, people suffer in silence without realizing that the cause might be right in their medicine cabinet. Across the United States, millions of men rely on antihypertensive medications to keep their blood pressure under control. While these drugs can be life-saving, the potential sexual side effects are rarely discussed during doctor's visits. Sexual side effects of blood pressure meds are real, and they can impact not only your confidence but your relationships as well. It's time we start an open conversation about how these common prescriptions affect more than just your heart. The link between blood pressure medication and ED is stronger than most people think. If you've noticed your erections aren't what they used to be since starting your medication, you're not alone. Blood pressure pills and sexual health are more connected than most men realize, yet this topic remains taboo in many households. As a urologist, my advice is simple. Awareness is the first step to regaining control of your health. Heart health and sexual function go hand in hand, but too often men are forced to choose one over the other. You shouldn't have to sacrifice intimacy for the sake of lowering your blood pressure. If you've been struggling with weak erections or suspect your medication is causing impotence, keep watching, because knowledge is power and there are options available. We're going to break the silence and put your well-being first. Every week, I help men just like you find real solutions for ED treatment. It's not just about a quick fix. It's about understanding what's happening in your body and taking steps to improve erections naturally, without giving up on your heart health. Remember, you deserve to enjoy both a healthy heart and a fulfilling sex life. No more choosing between the two. There's a smarter way. If you want to keep up with the latest advice from a real urologist, make sure to follow this channel right now. Don't miss out on updates that could change your life and help you take charge of your sexual health. Hypertension, or high blood pressure, is one of the most common chronic health conditions affecting adults in the United States. According to recent statistics, nearly half of all adults in America either have hypertension or are at risk of developing it. This widespread issue leads to a tremendous number of prescriptions for blood pressure medication each year. Yet, many people do not fully realize the consequences these drugs can have on their daily lives, including their sexual function. Managing high blood pressure is vital for preventing heart attacks, strokes, and other life-threatening conditions. Doctors routinely prescribe antihypertensive medications to help patients reach safer blood pressure levels. However, the connection between blood pressure medication and ED is often overlooked. For many men, taking these pills is simply part of their routine, without much thought to what side effects may follow down the road. The reality is that millions of Americans are taking antihypertensive medications every single day. These drugs come in different classes, each with their own unique benefits and risks. While they play a critical role in protecting your heart, it's important to acknowledge that some can also cause sexual side effects. Weak erections and other problems can slowly become part of your life, leaving you wondering what went wrong. As a urologist, I see countless men who are shocked to learn that their medication is behind their sexual health struggles. Erectile dysfunction isn't always caused by aging or stress. Sometimes, it's a direct result of the medicines meant to help your heart. Antihypertensive side effects can sneak up on you, often without warning, and have a real impact on your quality of life. The key is awareness. If you or someone you care about is on blood pressure medication and experiencing changes in sexual function, it's important to connect the dots. Weak erections may not be just a normal part of getting older. They could be related to your prescription. Recognizing this link is the first step toward finding a solution that works for both your heart and your sex life. More people need to understand the full effects of antihypertensive medications. By talking openly about blood pressure medication and ED, we can help men feel empowered to seek answers, instead of suffering in silence. Remember, you're not alone in facing these challenges. There is help available, and you have options. Antihypertensive medications are a group of drugs designed specifically to help lower high blood pressure. They are prescribed to millions of Americans each year and are a cornerstone in the fight against heart disease. These medications come in various types, including beta blockers, diuretics, ACE inhibitors, ARBs, and calcium channel blockers. Each class has its own mechanism and set of benefits, but all aim to protect your cardiovascular system. Doctors recommend these medications to manage blood pressure and reduce the risk of serious complications like strokes and heart attacks. For many patients, taking an antihypertensive is a lifelong commitment, and the effects go beyond simply lowering numbers on a chart. However, people often overlook the possibility that blood pressure medication and ED can be closely linked. Urologist advice can make a difference by highlighting what to expect from these drugs. Beta blockers, for example, are commonly prescribed after heart issues and can slow the heart rate. Diuretics help your body get rid of excess salt and water, which reduces blood volume and pressure. ACE inhibitors and ARBs work by relaxing blood vessels, making it easier for the heart to pump. Calcium channel blockers also relax blood vessels but through a slightly different process. Each of these can influence sexual side effects of blood pressure meds in distinct ways. Despite their life-saving roles, these drugs don't come without drawbacks. Many men report experiencing weak erections, reduced libido, or even other issues soon after starting their prescription. Understanding medication causing impotence is essential for both patients and doctors. Open discussions help men realize that their concerns are valid and, more importantly, common among those taking antihypertensives. Sometimes, people feel embarrassed to talk about sexual side effects with their healthcare provider. But as a urologist, I encourage you to bring these concerns to the table. ED treatment can only be effective if the underlying cause is addressed, and sometimes the solution is as simple as adjusting medication or switching drug classes. Knowledge is power when it comes to your sexual health. So, next time you reach for your blood pressure pills, remember they play a vital role in keeping your heart healthy, but they may also impact your sexual function. It's important to understand what you're taking and to have honest conversations with your doctor. Your heart health and sexual well-being are both worth protecting. When you take blood pressure medication, it starts working behind the scenes to help control your cardiovascular system. Each class of antihypertensive has a specific way of lowering blood pressure, either by relaxing blood vessels, reducing fluid in the body, or slowing the heart rate. The result is a steady reduction in blood pressure, lowering the risk of heart attacks and strokes. Urologist advice is clear. Always take your medication as prescribed and understand its effects on your body. Beta blockers, for instance, slow the heart rate and decrease the force of each heartbeat, helping to reduce pressure on the arteries. Diuretics, commonly known as water pills, remove excess fluid and salt from the body, lowering blood volume. ACE inhibitors and ARBs relax the blood vessels by blocking certain hormones. Calcium channel blockers work similarly but target a different process. These differences explain why the sexual side effects of blood pressure meds vary from person to person. While most people take these drugs for their heart, few realize they can affect other parts of the body, including sexual health. Weak erections are a known side effect, especially with beta blockers and diuretics. The connection between blood pressure medication and ED is rooted in how these drugs alter blood flow, hormone balance, and even nerve function. Sometimes the impact is gradual, so men might not connect the dots right away. Lesser-known side effects can include mood changes, fatigue, and decreased libido. For many, these symptoms are subtle at first but become more noticeable over time. Medication causing impotence doesn't just happen overnight. It's often the result of months or years on a particular prescription. Urologist advice is to pay close attention to any new symptoms and bring them up during routine checkups. If you've noticed changes in your energy, mood, or sexual performance after starting antihypertensive medication, don't ignore them. It's important to advocate for your health by sharing these concerns with your doctor. There are many ways to improve erections naturally and address ED treatment, but the first step is honest communication. The sooner you speak up, the sooner you can find a solution that works for you. Remember, no one should have to choose between heart health and sexual function. Blood pressure pills and sexual health are deeply connected, but with the right information and support, you can achieve balance. Stay informed, stay proactive, and never hesitate to ask questions about your treatment. One of the most significant issues men face with blood pressure medication is the direct link to erectile dysfunction. Beta blockers and thiazide diuretics are particularly notorious for causing weak erections. These drugs affect blood flow throughout the body, including to the penis, making it more difficult to achieve or maintain an erection. Many men don't realize that their sexual health struggles may be caused by a prescription intended to help their heart. Blood pressure medication and ED are closely connected, often in ways that aren't immediately obvious. The drugs work by altering circulation, which is vital for sexual performance. If the arteries are too relaxed or blood volume is too low, it becomes harder for the penis to fill with blood. Urologist advice always highlights this connection, encouraging men to monitor changes in their sexual health once they begin a new medication. Some men might feel embarrassed or frustrated when faced with weak erections, especially if they believe it's simply part of aging. But the truth is, many cases of erectile dysfunction can be traced directly to antihypertensive side effects. The key is recognizing the pattern. If ED starts soon after beginning a new prescription, it's worth discussing with your healthcare provider. Medication causing impotence doesn't have to be a life sentence. There are options available. ED treatment becomes much more effective when patients and doctors work together to identify the underlying cause. Sometimes, a small adjustment in medication is all it takes to restore sexual function. Other times, switching to a different class of antihypertensive can make a world of difference. Open communication is essential for finding the right solution for your unique situation. If you're looking for ongoing support, exclusive advice, and a place to connect with others facing similar challenges, consider joining our channel's membership club. Inside, you'll find access to in-depth content about ED treatment, lifestyle changes to improve erections naturally, and expert insights on blood pressure pills and sexual health. Becoming a member means you're never alone in this journey. Never underestimate the importance of proactive, informed decisions about your health. By understanding how blood pressure medication can impact sexual function, you empower yourself to make changes that support both your heart and your sex life. Don't settle for less. Explore your options and take charge of your well-being. Some blood pressure medications do more than just affect blood flow. They can also alter your body's hormonal balance. For instance, certain beta blockers and diuretics have been linked to lower testosterone levels in men. Testosterone is a key hormone for maintaining libido, energy, and healthy erections, so even small changes can have a big impact. Many patients don't realize that medication causing impotence may also be affecting their hormone levels. A decrease in testosterone doesn't just lead to weak erections. It can also result in a noticeable drop in sexual desire. This is why blood pressure medication and ED are often experienced together with symptoms like fatigue and reduced motivation. When the body's natural hormone balance is disrupted, sexual side effects of blood pressure meds become more pronounced. Men might also notice mood changes, such as irritability or sadness. Urologist advice in these cases is to pay attention to your body's signals. If you notice a sudden change in sexual function, mood, or energy after starting antihypertensive medication, discuss these issues openly with your healthcare provider. Don't let embarrassment hold you back. These are common experiences for many men taking heart health medications. The right ED treatment starts with a clear understanding of all contributing factors. Testing hormone levels can help pinpoint whether your symptoms are linked to your medication or another underlying health issue. In some cases, addressing hormonal imbalances can lead to significant improvement in both sexual function and overall quality of life. Treatment options may include switching medications, adjusting doses, or exploring therapies to boost testosterone levels naturally. Heart health and sexual function do not have to be mutually exclusive. It's also important to consider how age and lifestyle can interact with medication side effects. Older men are already more prone to hormonal fluctuations, and factors like obesity or high cholesterol can make matters worse. That's why urologist advice often includes a holistic approach, looking at every aspect of your health, not just your prescriptions. Improving erections naturally may require a combination of medical and lifestyle changes. Recognizing the link between blood pressure pills and sexual health is a critical step. By staying alert to hormonal changes and working closely with your doctor, you can protect both your heart and your sex life. Never ignore persistent symptoms. Solutions exist, and your well-being is worth every effort. While blood pressure medication and ED are often closely linked, other health factors can make the situation worse. Conditions such as diabetes, high cholesterol, and obesity are common among men with hypertension. These issues can damage blood vessels and nerves, making it even harder to achieve strong erections. Urologist advice always emphasizes a holistic look at your overall health. Smoking is another major contributor to weak erections and poor sexual health. The chemicals in cigarettes can harm the lining of blood vessels, further reducing blood flow to the penis. When combined with the sexual side effects of blood pressure meds, smoking can make erectile dysfunction nearly impossible to overcome. The same is true for excessive alcohol consumption, which impairs both circulation and hormone production. Living a sedentary lifestyle can also impact sexual function. Lack of exercise leads to weight gain, reduced cardiovascular fitness, and higher risk for chronic diseases. These factors add up, increasing the likelihood that medication causing impotence will hit harder. Heart health and sexual function are both improved by regular physical activity and a balanced diet. Mental health matters too. Stress, anxiety, and depression can all contribute to ED, especially in men who are already dealing with antihypertensive side effects. Sometimes, the psychological burden of weak erections becomes a cycle that's hard to break. That's why urologist advice often includes counseling or therapy as part of a comprehensive ED treatment plan. It's important to recognize the cumulative effect of these risk factors. When lifestyle issues stack on top of blood pressure medication and ED, the result is often more severe and harder to manage. But the good news is that many of these factors are within your control. By making changes step by step, you can improve erections naturally and boost your overall quality of life. Don't underestimate the power of small adjustments. Whether it's quitting smoking, cutting back on alcohol, losing weight, or addressing mental health concerns, every positive change makes a difference. You have the power to influence both your heart health and your sexual well-being. Take action today to break the cycle and move toward lasting improvement. If you begin to notice symptoms like weak erections or decreased libido after starting blood pressure medication, don't panic. The most important thing is to never stop your medication without consulting your doctor first. Suddenly stopping antihypertensive drugs can be dangerous and put your heart health at risk. Urologist advice always stresses the need for careful, professional guidance. Open communication with your healthcare provider is crucial. Many men feel embarrassed or worry about being judged, but your doctor has seen it all before. By honestly describing your symptoms, including any sexual side effects of blood pressure meds, you help your provider find the safest, most effective solution. Remember, medication causing impotence is a common issue and your concerns are valid. Sometimes the answer is as simple as adjusting your dosage. In other cases, your doctor may suggest switching to a different class of blood pressure pills with fewer sexual side effects. This kind of personalized care can make a significant difference in both your heart health and your sexual function. Don't settle for feeling less than. Ask about options for ED treatment that work for you. Never try to treat erectile dysfunction on your own with supplements or unapproved remedies. These can interact with blood pressure medication and lead to serious health risks. Urologist advice is always to seek professional input before making changes. Safe and effective ED treatment starts with a clear understanding of your overall medical picture. Lifestyle changes can also play a big role in improving erections naturally. Discuss with your doctor how adjustments in diet, exercise, or quitting smoking can support both your heart and sexual health. Sometimes, a combination of medication tweaks and healthier habits is the best path forward. Every positive step adds up over time. You are not alone in facing these challenges. Countless men deal with the same issues every day, and there are proven strategies to help. By staying proactive and building a partnership with your healthcare team, you put yourself in the best position to protect both your heart and your sexual well-being. When it comes to ED treatment, there are more options today than ever before. Many men benefit from adding medications like Viagra or Cialis, which specifically target weak erections caused by blood pressure medication. These drugs work by improving blood flow to the penis, making it easier to achieve and maintain an erection. Urologist advice is to only use these with a doctor's supervision, especially if you have heart health concerns. Lifestyle changes are equally important. Simple adjustments in diet, such as reducing salt intake and increasing fruits and vegetables, can support both heart health and sexual function. Regular exercise boosts circulation and helps maintain healthy blood pressure, improving erections naturally over time. Quitting smoking and moderating alcohol are also powerful steps that make a real difference. Don't underestimate the role of emotional health. Anxiety, depression, and stress can all worsen the sexual side effects of blood pressure meds. Sometimes, counseling or therapy is needed as part of a holistic ED treatment plan. Discussing these issues openly with your healthcare provider is a sign of strength, not weakness. Mental well-being is just as important as physical health. In some cases, your doctor may suggest switching to a different class of antihypertensive medication with fewer side effects. Medication causing impotence doesn't have to be permanent. There are many alternatives available. Every patient is different, so it's essential to find a solution tailored to your specific needs. Urologist advice is to stay persistent and explore all your options. If you're already a member of our channel, remember to check out the exclusive content dedicated to advanced ED treatments and natural ways to improve erections. Being part of a supportive community can make the journey easier and less isolating. Sharing your story and learning from others helps everyone move forward together. No matter what, don't give up. With the right combination of medical guidance, lifestyle adjustments, and support, you can regain confidence and enjoy a fulfilling sex life. The path to better heart health and sexual function is within reach. You just have to take the first step. Taking care of your heart and protecting your sexual health should never feel like a trade-off. Blood pressure medication and ED are linked, but with the right information and proactive choices, you can achieve balance. Don't let weak erections or sexual side effects of blood pressure meds hold you back from living fully. Urologist advice is always to seek help and take your concerns seriously. Remember, millions of men face similar challenges every day. You are not alone, and solutions are available. Medication causing impotence is a common issue, but with open communication and professional guidance, it's possible to restore both confidence and quality of life. Improving erections naturally while maintaining heart health is a realistic goal for most men. If you found this information helpful, consider sharing it with someone who might benefit. Raising awareness about the link between blood pressure pills and sexual health can help others take control of their well-being. Our mission is to make sure no one suffers in silence or misses out on the support they deserve. Every conversation matters. Take this as a sign to have that conversation with your doctor. Whether it's about ED treatment, hormone changes, or lifestyle modifications, now is the time to act. The sooner you address your concerns, the sooner you can enjoy the rewards of better health and intimacy. Don't wait for symptoms to worsen before seeking answers. You deserve a life where heart health and sexual function go hand in hand. Prioritize both, and don't be afraid to demand solutions that work for you. As a urologist, I've seen countless men reclaim their vitality. There's every reason to believe you can do the same. Stay informed, stay proactive, and never settle for less than you deserve. If you haven't already, subscribe to the channel for more expert advice and share this video with friends or family. Your health journey matters, and we're here to support you every step of the way.